All right, what's up, everybody? Super excited for our are we calling this a workshop, Brian? What are we calling this?
I thought it was a happy hour, back
That's right.
happy
Yeah,
hour.
you like that, yeah. So now, yeah, it used to be called a workshop. Now we call them happy hours when we're on Zoom at 5 o'clock. So today is a happy hour with a topic of back pain and prevention. And we have Dr. Brien Fischer here. His name on his thing says Nadine, but
yeah, using Nadine's laptop.
I know him to be Dr. Brien Fischer. So Brian can introduce himself a little bit more, but I've known Brian for a long time now. He used to actually be a client of mine back at 18 years old, I believe. He went to CSM and he was a baseball player, pitcher, and he just always had a passion to improve himself, just like me. Always wanted to get better for baseball, and there's always, like me, we had injuries along the way. And when you have injuries, when you have challenges, oftentimes that allows you to keep pursuing, something more, right? Many of us who are in the health and wellness industry we're just trying to figure out ourselves. So Brian is, he went on to massage school. We did a lot of work together. He then went on to massage school, got a bachelor's degree. What was it, exercise physiology?
Kinesiology with the emphasis movement science, yeah.
Kinesiology, and then just got his doctorate in physical therapy. So pretty cool, man. Congratulations. I know it was a very long road, and I know he's not done yet. He's the guy that's just going to continue to strive for more and more and more. So, although he graduated recently, he's really a wealth of knowledge because he had already been working in the field as a trainer, as a massage therapist, worked with the 49ers and other, and also in a physical therapy clinic. So yeah, he did graduate recently, but he is way above most graduates, I'm sure. So he'll be speaking tonight. And, at the end of this, Brian, if you can even do it now, if you can put your contact information in the chat box, Brian, that would be great. Okay. And then so people can reach out to you afterwards if they have any more information. Also, he's in Redwood City. So, a lot of these folks are in the Bay Area, but we have a few folks from out of the area as well. So he does do like teletherapy type stuff too. So, all right, Brian, take it away, buddy. And then you want me to do the PowerPoint, is that right?
Yeah, that works. Just if you got it ready, that'd be perfect. I was going to tell you when to go on next slide.
All right, here's Brian, guys. I'm going to put myself on mute, and you just tell me what to do with the PowerPoint.
If you want to just put the first slide up, and I can kind of just chat a little bit as we're going through this, that would probably be pretty easy. But yeah, thanks a lot for all hopping on here today. Like, that was a great introduction that Brian gave me. Like you said, we've been known each other for a long time, and I saw it from the training perspective, the massage perspective, now from the physical therapy perspective, that back pain is it's kind of another kind of epidemic we're dealing with. We've had it for a long time. I think everyone's going to deal with back pain one time or another, and it's pretty debilitating. I know I've been through it. I'm sure Brian's been through it. We've all been through some sort of back pain, and it can knock us out. So today I kind of want to give some ideas about some things we can do. So first of all, some education, some statistics as to how prevalent it is, where in the medical model we're kind of going wrong with this, and some things you can kind of check out for yourself when you do have a back pain situation. You can kind of do some self-assessments. So then we'll go from there, and then I'm going to show a couple of exercises. I'll just have me on camera showing a few of them, and then I'll leave it up for a little bit of Q&A. I know I came on a little bit late, but I don't want to keep you all too late tonight, so we'll be done around maybe 6:15 at the latest, but I'll definitely answer some questions for you all, and my information will be there. There's also a slide at the end of this presentation with my information again, but I did put it in the chat, and I'll be more than happy to ask or answer any of your questions if you think of something later on. We are located here in Redwood City, right off the 101. I'm all around the Bay Area here. So that's my introduction, and we'll get started. So topic is today, let's get back to health, back pain prevention, and some coping strategies. And we'll go on to the next slide. All right, so why is this a problem? So you can kind of click through this. The reason why it's a problem is because the cost of care of low back pain it's astronomical. It's about $100 billion annually, and it really is the leading cause of disability worldwide. And again, we all want Right now, we're not working so much. We're probably sitting around at work a lot, but it is number one days and works lost per week. So when we do get back to work, we want to make sure we're taking this account. And think about the dollars of productivity time we've lost per year, $61.2 billion. And again, opioids, it's a problem in this country. We overprescribe way too much, way too soon. And hopefully I gave you some strategies today to help you with some opportunities to not have to go into opioids right away. So the first thing is, I'm a physical therapist. Usually people see me when they're already in pain, but I want to be here for you before pain even happens. So injury prevention is the key. And so I want you to look at your lifestyle. People think about the perfect training program, the perfect physical therapy exercises. What can I do? But I always take a step back and look at my clients and my patients and say, what's your day life like? What's your job like? Are you sitting 10, 12 hours a day? How are you sleeping? How are you eating? Are you in an inflammatory state all the time? What's your past medical history? Have you had prior injuries? All the time, I want you to take a step back and think, is there something else in my patterns of my lifestyle that I can make some adjustments to? And that's the conversations you'd have with Brian, you'd have with myself. So that's just some reflection you can think about after this presentation. But you can also assess your own back. So this is something we can think about. Say your back is bothering you. So you ask yourself, well, when does your back bother you? When does it feel better? This is really important to know about aggravating factors and easing factors. If you don't know, like if people ask me, well, I don't know when my back really hurts, it just kind of hurts. Some of the general assessment that I do with my patients that you could do with yourself would be, so the next slide, I'll have them click one over, is does bending forward make your back feel better or worse? Does bending backwards, side bending, twisting, rotating? So if I have someone in front of you, you can always just think about, does it bother you? Bending forward, bending backwards, side bending, and twisting. That can tell you a lot, because when people think about back pain, you hear about disc bulges, sciatica, stenosis, anything you think of. Not one back is treated the same. However, certain back, injuries or pain can be going back to what actual position caused the pain. So, for example, typically when people have sciatic pain, a lot of bending forward is a problem. So if you can kind of self-assess yourself and say, man, every time I bend forward, it bothers me. Maybe I need to do more back bending and extension-based exercises in the short term to help you not keep re-irritating your back. So you got to know what to do, what to modify, but these are just some ideas that I know when you go see Brian, or you go see myself, or go see your physician, the more information you can tell that person is going to help us as health and medical professionals know if we're seeing patterns. We can build better programs for you. We can look at your lifestyle and see when your back is really bothering you. So this is just ergonomics. This kind of follows up. This is the Newton's force of basically what your back goes through during certain positions. So we talk about the big one on the right, that's 275 Newton forces on your lower back. Posture is debatable a little bit on how straight upright we have to be all the time. The biggest thing I'm a believer in is good body mechanics, and then not staying in one posture for too long. Movement is good. So sitting at the desk for 10 hours or standing at the desk for 2 hours are both problematic. We want to be moving frequently, but this is kind of an idea that you look at the bottom left, 25 Newton force laying on your back. If you do have back pain, people typically like to lay on their back first to reduce the compression forces. So again, if a flare-up happens, temporarily, typically laying on your back is a good initial start to not have your back flare up even more. But we'll get into more of that later.
Hey Brian, real quick here. So
Sure.
this is something that I've seen for like 25 years, this chart.
Yep.
And this is like something I think everybody should have ingrained in their head, because it's something that I've always thought about. And just look at the forces of lying. This is why why lying on your back makes you feel better, right? And why good posture makes you feel better. But as soon as you start bending forward, we start seeing some bad things happen. But more, what's interesting is when that slouched position, right? And at 275 pounds of force. But I was just going to bring up the fact that we do a lot of bent over rows,
Yep.
and this is a great exercise, but also a very problematic exercise at the same time. So if you guys look at 220 right there, I just want to, because at home, unfortunately, at home exercise programs, we don't have a lot of ways to pull. And, a lot of people don't have bands, they don't have TRXs. So we tend to do a lot of bent over rows. So we want to make sure, guys, that you're, drawing that belly in and being in a really, really good posture when you're doing that bent over row. Be very careful with that exercise. If you have any ideas too, Brian, about breathing in that position specifically, I don't know if you want to talk about that
Yeah.
now or later. Or...
Yeah, I'll just, while we're on the topic of it, and so to kind of about what you program with your clients, and I do with my patients, is the hip hinge, right?
Yes,
So when people see this picture, you can draw a straight line from that butt to the ankle. It looks completely straight down. When we learn actually how to hip hinge properly, we get posterior weight shift in our hips. That automatically takes the line of force from our back to our butt and hamstrings, where we want the force to happen. So we talk about the SAID principle, SAID, specific adaptations for imposed demands. So these, I don't want anybody to be ever afraid of movement, but how we do it in the right kind of loading, the right kind of programming is good. And I think the biggest thing I see problems with back pain is people don't know how to hip hinge properly. We live in a seated posture. So that one on the 220, that is not a very good hip hinge position. They're basically picking up a box way in front of them, which is putting pain on the lower back. So the bent to a rows, the deadlifts, all that stuff I program as well with my patients, super important. But with anything, with improper form and an excess load, that's where some of us get in trouble.
Cool. All right.
All right. So I bring this up because discs are made of fluid and they help absorb shock, and they basically need that. Think about, you're greasing up the old car, right? We don't, it's not about blood flow, it's about actually getting movement in the joints. That's how they actually move. So when we're in a dehydrated state, those discs aren't actually moving too well. That's why we wake up in the morning, a lot of times we're extra stiff, we're extra dehydrated. I'm sure Brian has told you a lot about drinking water. So I just throw this in here, not to go super in depth, but again, this is kind of the stuff I was just mentioning here. And then as a rule of thumb, I mean, there's so many different things out there. I just tell people, I think it's the next one, the next slide over here says, you know, drink a half an ounce to an ounce of your body per pound of body weight. That's kind of a rough estimate. And Brian, if you want to chime in and have different relative ways to get people to drink more water, but I just want it on their mind to have some kind of goal versus just throwing out a bottle here, a bottle there, and not really knowing. Anything you want to add to that?
Yeah, I actually just mentioned this because I had some extra time with your technical issues before you came on. I was like, how much water do you guys have, you know? So yeah, this is a real key one, guys. So I usually say half your body weight in ounces of water at the very minimum. But remember, you know, the more you weigh, that's a hell of a lot of water, right? I got some people 300 pounds or more. So we'll just use that 300-pound example. That's 150 ounces. And you know, and I know that's a lot. So what I do with people is I'm all about helping people with figuring out how to make that a routine. So one thing to think out, whether you drink the amount of water you need or not, let's try to start your day with water. I think it's probably one of the most important things you can do. And it really starts with the routine you have at night. So what I do and what my wife does is we get water, we put it in the bathroom or next to our bed every single night. And that allows us to always remember to drink our water. Because I talk a lot. I don't drink a lot of water because I talk a lot. So, but I start my day with water. I fill up a mason jar with 24 ounces. I drink it within the first 30 minutes. And that really helps me get ahead of the day, you know? So just kind of remember that. Start your day with water. Every meal, have like 1 to 2 cups a day. 1 to 2 cups prior to your meal. Just think about how you can fit it into your day. With exercise, think about drinking another 4 ounces every 15 minutes. That's kind of another added need for water. And then lastly, remember one thing I see a lot, because I use the Renfo scale, Brian, and it tells us total body water. It's a $35 scale, but most people, we want to see them around 55% or more total body water. I see people at 25, 30% total body water. So it's not just drinking water, it's also minerals. We see a lot of people who are deficient in minerals, like, and I recommend, having pink Himalayan salt, like 2 teaspoons a day, magnesium, zinc, those are very helpful. Mineral water, anything you could do to get more minerals will also help hydrate your disc. There you go.
Totally agree. All right. So the next thing is sleep, right? Sleep is where recovery happens. I think people forget about this a little bit. So 7 to 9 hours is pretty ideal, but again, what's the quality like? So stage 4 is really where we get our recovery. So anything that you've learned that day, the memory, if you're studying for an exam of some sort, all that memory is going to be in that deep stage 4 sleep. A lot of times we miss those deep REM sleeps. So if you go to the next slide here, I think it's We looked at sleep aids. You're taking your melatonin, you're taking other things. It might make you feel like you knock out longer, especially if you have a few cocktails. You're like, man, I knocked out. The problem is that you feel groggy because you never got to the stage 4 sleep. You might have knocked out sooner, but there are other GABA, serotonin, melatonin. Those are like natural, basically neurotransmitters our body produces. So there is a ton of other things. Don't need to go super depth in this, but I want you to just think about your sleep. And again, eat quality foods. I'm all about so go ahead and click next one, the omega-3 fatty acids, leafy greens, green tea, stay away from the high inflammatory omega-6s, just basic things to think about. And the next slide is the plug-in for you. Because I said, listen to Shamp, he knows way more than I do about this stuff. I don't go too in depth, but it is a portion of what we talk about for recovery from an injury standpoint. If you're always in an inflammatory state, it's really hard to recover from back pain. So yeah, and then so the next slide, I just want to get into how this all really happens, right? The pain paradigm. So there's kind of 3 ways how we get in this weird state of a pain cycle. Maybe you have a previous injury. You hurt your back, years and years ago. And then when that happened, you kind of walked a little bit of a limp, kind of funky. You went to that green box versus ultramotor control. You started moving kind of weird. The pain went away, but now that's your new normal. So for years and years, the pain went away, but you learned how to walk funky because your back pain, and now that's your new normal. So now you're putting stress on your body many, many times. Could be starting from ultramotor control. Anybody ever wake up in the morning with their neck with a neck kink? You didn't really injure yourself. You just slept long on the pillow. And now you walk around your neck kind of sideways. The pain gets better, but now your new normal is to the side. We never really fixed that. Or you just literally just stubbed and hurt your back and you work that cycle. No matter where you are, the entire picture plays a role. So when I look at getting people back to function, I think the green box is really important. We look at the injury, look at the pain, and we just focus on those 2 all the time and focus on the symptoms. We really don't actually focus on movement quality, and that's where the ultramotor control comes into place. That's where people like Brian and me are always trying to improve good form, good quality, so that you're not going in this cycle again. That's the pain paradigm. So roadmap. This is kind of the thing I look at. Number 1 I see is achieve mobility is the number 1 for me. Now we have outliers. We have hypermobile people. We have people that are super flexible. Those, as a society, majority of what I see is people are kind of tight. So I always look at, you got to get flexibility. Next thing is we stabilize with corrective exercises. So we get a range of motion that's supposed to be there. And then we learn, so a little moment of thought here is that our brain, when we're tight, a lot of times it's because our nervous system is protective. So I always use this analogy of a baby when they're born they're loosey-goosey, their head's all over the place, their legs are all over the place, you can bend them all over. But over time, when we don't use those movements, our body becomes more tight because it's saying, well, we never really use that movement, so why do I need to stay limber for that? So we become tight more for protective reasons. So I always look at, restore the mobility. Then we just got this new range of motion. We're like, what do we do now? This is where I have a gripe as a massage therapist myself, or we go to see maybe chiropractors, or we do acupuncture. All that stuff is great, but we have to reinforce with good movement, because if we don't use that window of opportunity to enforce good movement, our brain says, well, that was great, felt good for a little bit, let's go back to being tight again. So as soon as we get some mobility within that session, that's why we do dynamic warm-ups, that's why we do stretching, and we follow it up with exercise, so your brain starts to learn, and now we can actually control that new movement we just got. Once that happens, we think more global. We think movement patterns, okay? Great, we got our shoulder moving. Well, now we can actually do an overhead squat if we wanted to. So we start building these blocks, okay? And then number 4 is going to be, you have a good movement pattern. We've been working on that hip hinge for weeks and weeks. Now it's time to load it. We talk about that specific adaptation for imposed demands. That's resiliency. When I see people with back pain, it's getting strong. You can only do so many stretches, so many corrective exercises. You have to build a really strong body to withstand what we're doing all day on our backs. So next slide, we look at the joint by joint approach. We talk about mobility, about what should be stable, what should be mobile. So we go back 1 slide, there we go. These are just basically guidelines of thinking about your body, right? If you look at your shoulder, that's a very mobile joint. We should be pretty flexible with this. The elbow, that just moves one way. That should be pretty stable. We're not moving our elbow in a bunch of different directions. The thoracic spine right here, that's a very mobile joint. We should be able to move that all over the place. The low back is supposed to be a stable joint. It's not supposed to be this huge mobile thing we're using all the time. But the problem is that we see a lot of issues where when the hip, that should be mobile, it's there in pink, and the thoracic spine above the back, that's pink, when those 2 aren't doing its job and it's stiff and I got to twist and rotate and move and hinge, and I can't get there because my hips are tight, my upper back is tight, where am I going to move from? I'm moving from the lumbar spine, and that is when we have the lumbar spine doing a job it's not supposed to be doing, and that's when we start seeing these really tweaks and bad injuries. So I look at it as just to keep it simple. What's supposed to be loose? Let's loosen up those joints. What's supposed to be stable? Let's strengthen those and get them stable. It's a really simplistic way to kind of take a look back at your body. And so the next slide is going to be the core, right? The core is very important. It is not just the abdominal muscles, the six-pack abs. It's actually a 360-degree cylinder from all the way around, many layers of muscles. So problem is we do a lot of crunches, but I want you to think about the core as not only creating movement, but it's also resisting movement. So when anytime back pain happens, look at the multifidi right there, it's listed on that picture. Whenever there's pain, those muscles kind of get a little funky. They've done a ton of research. Those are the muscles that really kind of shut off when you have back pain. And those are your main stabilizers of your spine. They're not even on the front of your spine. They're on the back of your spine where the back pain is. So when we have acute back pain, we got to start thinking, again, that very specific level, get that motor control back, and then we start building bigger muscles and movement patterns. So as we click through a couple of the next ones here, Brian, it's the only thing that separates the upper body from lower body. So if I'm doing rotation and hinging and moving, that core has to stabilize us. And it's the first thing it has to activate. And we see when people have back pain, there's actually a delay in activity of that back. So when you're supposed to hip hinge and that core is supposed to actually innately fire and stabilize, there's actually a delay, which then puts all the stress on those structures around the lower back. So how we look at the core is going to be a couple things about resisting movement. I look at it as, can you resist rotation? Can you resist extension, flexion, side bending? That's where it's going to create a reflexive stability pattern when you have to move around all day. And next one there, Brian. I think, yeah, there you go. If there's no stability, again, the other parts of your body have to take over for sure. And then the diaphragm, big portion. So I see people with pain, the breathing pattern's always off. We kind of live in a very high stress lifestyle sometimes. And when people are not using their diaphragm, which is one of the basis of engaging your core, a lot of things can go wrong. So I'm always looking, again, lifestyle. Is stress taking over? Am I a chest breather, a neck breather? Am I not even using my diaphragm? Because when you're breathing hard and you're working hard, that diaphragm has to be working pretty well. So if you look at the next slide, we don't need to go into all this physiology stuff, but you can see anxiety sticks out right there. You have a very stressful life for some reason. You get this sympathetic fight or flight response. You become tense. Your upper body gets there's a lot of tension. Your breathing gets increased. You become more alkalosis in your blood. It's like this huge. And there's a lot of stuff going on here, but I see a lot of times when people are in back pain, or even just not in pain, but they have some issues with their back, I look at their breathing first, and that's something we can really retrain fairly quickly. We can do definitely some corrective exercises to really get you to start thinking differently about your breathing for sure. So we don't need to get super in depth on that slide. And next one.
Hey, Brian, just real quick on that. So Brian and I, before you went to your doctorate program, actually did a bunch of videos on breathing that are somewhere buried in Facebook land. But it's something that, we start every one of our workouts with in different positions, whether it be on all fours, seated, standing, bent over, you name it. And also, I've seen some interesting things because, I mostly focus on the nutrition lifestyle piece nowadays. And I have a lot of folks that get frustrated. We have, I think, Joan, I think more Patty can remember this one. But a lot of times people get frustrated by their weight, right? And they're like, I don't know why my weight's up. And they're just stressed, they're anxious about life or whatever. And I'm like, I ask them questions like, how you doing? How's the food going? How's the water going? How's your sleep going? They're like, I'm doing everything. I'm working out. And I'm like, okay, well, how are you doing with your breathing? Are you taking the time to just take a few slow, deep, conscious breaths during the day? And usually they say no. And I'm like, okay, cool. Well, let's just work on that. Just for the next 2 days or so, I want you to breathe. Just take the time to breathe even more. And almost always when people really breathe from the diaphragm and not their chest, when they become aware of that, they almost always lose a minimum of 1 to 2 pounds the next day. So I know we're talking about back pain here, but we're talking about everything here.
Sure.
So we're talking about weight, body fat, belly fat, guys. So just understand this is probably the most important thing. You just kind of glossed over it, but remember breathing.
and like as healthcare and fitness professionals, I mean, people come in to see us with a back pain issue, but I mean, I want to get you back to your quality of life. If it's affecting your stress, your daily activities, you can't go do things with your family, your loved ones, you want to lose a weight goal, whatever it may be, this is all part of the big picture of helping just a general overview of how's all quadrants of my health and fitness. So, and it's going to help your workouts better too. When you can actually breathe efficiently, you're actually not going to get as fatigued as quickly. You're not more likely to row with your upper traps. You're able to use your lower traps for posture. So we start on a basic level, but then it actually funnels really into your high level training programs too. So we talked about human movements. These are the kind of the basic ones you want to kind of think about as you're programming. You know, Brian probably gives you some great workouts that cover all of these. But if you ever did things on your own, we want to look at, you know, the human movements of pushing, pulling, squatting, hinging, and carrying. That's kind of the 5 categories you break it down, and you can get creative with a lot of different areas. But the low back is going to be involved in all of these. So it could be affected on any of them. So when we want to have a healthy back, I'm looking at, out of all these patterns, where is maybe your weak link that we need to really address? And because they're all going to affect your core and your lower back in different ways. So this is a couple pictures here. Again, building strength. Once you have the movement patterns down, now we're ready to load it. You got to actually build strength. So doing body weight is good. You get the form down, but at some point we have to actually push the system a little bit more so your body has a chance to be resilient and handle those loads and forces when you have to move that chair or that couch or something in your life where people see, like, that was the thing that hurt me. I lifted up, you know, that couch, I moved it and it hurt my back, right? So it all comes down to these foundations. So what do we do when there is pain? So this was a study that was a pretty good one that I learned about in school about back pain. So there's the resource there if you want to read about it. And the next, I'm going to kind of summarize in these next slides here. So there's over 400,000 patients analyzed. And when patients actually got to PT, within the first 4 weeks, as compared to the chronic stay over 3 months, they had 38% less surgeries, 46% less injections, and 47% less physician office visits. Less imaging, less healthcare, less opioids, less surgeries. So this isn't a huge plug for me. I want to try and make sure between Brian and me, we make a good team. He's actually keeping you healthy, but at some point, if it happens and it's acute, and we've all been there, you know, we can do a lot of good help for physical therapy to get you in right away, to give you a full-on assessment, and can get you on a program before we have to go to maybe some of those more severe things down the road.
I find that, you know, most people, I've learned my lesson. I've been injured since 12. So I recover faster at 47 from injuries than I did at 12. And I believe that's just because I don't wait that long, where I find that most people, even that I work with, they're like, you know, like, my back hurts, I'm going to go ahead and I'm not going to work out for a couple of days. And then all of a sudden it turns into a week. And then they're like, well, you know, I'm still hurting, Brian. I'm going to take another week off. And then by the time they finally go to seek help, it's usually a month down the road. You know, it's usually very, very late.
Yep, we can get things going day one, rather to bring down your initial painful symptoms. Or again, we talk about that pain paradigm. You don't do anything for that first month. You've been doing nothing or moving funky for a month, and now you have a lot more things we got to unpackage by the time you actually see us. So definitely think about that next time you're in some pain, to try and get some help. The worst thing we can do is lay on our backs. There's been study after study that shows laying in bed on your back when you have back pain is the worst thing we can do. Your back needs movement. We just need to figure out what kind of movements, what kind of things we can do in a safe manner. So next slide. Okay, so what I'm going to do now is, this is a back warm-up program I put together. I'm just going to show you guys a couple of them, just a couple of things you've probably seen 100 times, but maybe a couple of cues I can give you to help you a little bit. After this, everyone that's on here, you're going to have my email address. It's about 15, 20 exercises, got some core, got some stretches. Just email me and I'll ship it off to you, the full program. You're beyond here with me at this time and listen to me talk. So that's my little gift to you, just to have a resource for some things you can have on your own for whenever you like. So just contact me after that. And so next slide. And here's the information too. So I did put in the chat, but here's again if one wants to get it. So I mean, my Instagram, I do a ton of exercise videos too. So you can have a plethora of things if you want to shoot me a follow or just check out my page. I got a ton of things for you. Elevate Performance Physical Therapy is the place I work at here in Redwood City. But we're always pushing out content between the two of us. And again, Brian's got people across the whole country. We do telehealth stuff here. It is a cash-based practice we do here, but again, it's $50 if you want to hop on for a half hour, and I can do an assessment and give you some things tailored to you if you are not in the area and you want to reach out to me from wherever you're from today. So you got that there. If everyone wrote it down, and then if you don't have the information, Brian can send it out to you as well for some reason, but that's the way to reach me. So that concludes the PowerPoint presentation part. I just want to go over a couple of exercises we can do together. And so I got the screen here. I'm just going to show you 2 or 3 things, and you can feel free to do them with me. You could just kind of watch what I'm doing. It always helps to feel it and do it yourself, but I'm just going to show you 2 or 3 things, and then I'll leave a little Q&A open for a few minutes if you have any questions, okay? So I'm going to head out to my area out here. And everyone can see me. Hopefully this will be good. All right. So first one I'm going to do here is one you've probably done a lot of times, but it's the glute bridge. Okay, I see people do this one too much with their back and actually not using the glutes. We talk about the hip hinge, the squat. Using your butt muscles is going to be super important to take the load off that back. So there's a couple of tricks that I kind of get to make sure people are really using their butt and not their lower back. So I'm going to kind of walk you through this step here. So people oftentimes don't know how to squeeze their butt muscles. So what I have people do first is I have them lay on the ground, and I just have them try and squeeze their left butt cheek and right butt cheek, and just see if they feel same or different. And if you need to put your hands there to do it too, but you'll start to see like, oh, is one side harder than the other? I don't really know. So you practice that a couple times. Then I want you to get here. I want you to do the same process. It's going to be harder, but can you squeeze? The glute is stretched right now, so it will be more difficult, but you might have to spend some time here. You might say, wow, my left one fires really well. My right one's actually not firing at all. My right back hurts. So you might have to spend some time here for a little while. Once you feel like you got it, you're like, okay, it feels equal. Now what I want you to think about doing is I really want you to push through your heels. If you push through our toes, we end up using too much quad. Push through the heels, squeeze the butt, and I want you to kind of roll up. Roll up and really keep squeezing those muscles here. The mistake I see is people don't use this, and they arch their back and they lift from their back. And now I'm just putting more stress on my back that I don't want. So again, I'm going to kind of engage my core a little bit, make sure it's on, squeezing hard, and rolling up through. Okay, and if that becomes too easy, you can do one legs. You can do alternating. There's tons of progressions, but if I have a problem doing it in this position, when I do squats, when I do hip hinges, very much difficult to do. So I want you to think about next time you're doing bridges in a class or by yourself, think about that one, very important. Next one I'm gonna do is the bird dog. Maybe you've seen this one before as well. But here's another thing, is position of your lower back. So when I see people do this exercise, a lot of times they'll do 2 things. They're going to really arch their back, and they kind of hang out on the lower back. And really, you're not getting any core stabilization there. So I think about, I want you to arch your back. I want you to round your back a couple times. Okay, I want you to find where is your end ranges. This is fully extended. This is fully rounded. Find what's in the middle for you. That's pretty flat for me there. So I'm actually engaging my core a little bit here. What I'm going to do is I'm going to get tall through my shoulders. And I'm going to practice just one at a time. Can I actually reach my hand out? Can I stabilize? Can I reach out the other one? Can I reach out just the leg? And this one, I don't want to see that dipping happen or a rotating happening, okay? Very much straight through, okay? You do all 4 of those, looks pretty good. That's when you're going to engage here and breathe. I like to hold a breath here. I like you to do a breath in this holding position. Because again, it comes back to the breathing. If I'm super tense and I'm holding my breath, I'm not getting a good engagement of my core. So I should be able to hang out here, breathe through it, and come back. Okay? And there's tons of progressions to that, but I see a lot of mistakes where people end up using their back too much. Okay? And the last one I'm going to do is a hip warm-up. So a lot of times with back pain, the hips are actually pretty tight in the front. So I want to do more of a dynamic warm-up for your hips, okay? So what I'm going to have you do here is a lot of times you'll see people kind of do this stretch where they kind of hang out like this. But again, here's a mistake. We lean on our back, and now my back is hurting, not really getting much of a stretch here. So I'm going to lock in my shoulder, hip, and knee. I'm going to tuck my butt under. Think about if I had a belt buckle, I'm going to try and point my belt buckle up towards my nose. That's going to fire my glute, and I'm going to start feeling a stretch here. So when I'm in this position now, and I lean forward, purely hip, not back, Okay. So once you get that down, you feel pretty good about that. Instead of just like hanging out here for 30 seconds, I actually want to make it more dynamic. So we're going to go about 10 to 15 of these, keep that same motion. And then we're going to go out 45 degrees. You can still see my logo. I'm not hanging out this way. Still facing you. We're going to go 10 to 15 here. And then you're going to go all the way up to 90 degrees. Square up the shoulders. 10 to 15 here. And then hanging out in this position, I'm going to rock back towards this knee here. 10 to 15 here. And again, if you got knee problems, we can always modify these things. I'm just giving general recommendations, but you're getting that hip joint to move all different directions, right? Because I talked about a mobile hip and a mobile upper back is going to help the lower back not have to do the work. The program will have extra things for your thoracic spine as well. So those are just 3 couple tips. The key though, sorry about the crazy camera. Hopefully no one's getting motion sickness there. The key to that is form. Really understanding how, I've done that exercise a million times, but knowing what to feel is really important. We don't want to have the lower back do more things than it has to. So I think if we go through these exercises, Brian knows them pretty well too. A couple of little coaching cues, a couple of things I thought about. Question, what am I supposed to feel in this exercise? So that's just 3 things. I think there's about 15 on that sheet that you'll get. So feel free to email me and I'll get that over to you. And that's it really for me. The rest of it's just going to be questions if anybody has anything.
Hey, Brian, couple things. One, on the bridge, you were saying, I missed part of that. You said, don't just go up. You said you were talking about engaging your glutes, specifically both sides of your glutes.
Yep.
So when you were doing the bridge, you said, don't do this. I missed what you said, don't do. Just don't fling it up. You want to squeeze to the top, right?
Yeah, I almost think like if this is my hips, I'm trying to roll up through my butt versus just using my back to just keep arching through my back. People end up just jamming through the lower back and ramping up versus squeezing your glutes and kind of roll up from your butt first. You don't need to get as high as you think you do. People think that this bridge, you got to shoot straight up. You really just got to get equal with your hips, maybe a smidge higher, but you're really making sure those butt muscles that you've been working on should be activated the entire time that you're going up there. If you feel them not working, you're probably using your hamstrings and your low back only.
Got it. And then Lisa said, or Lisa Mike were there. They said, can you repeat the three things again? You froze. I think it was the 3 exercises, I believe, but just real quickly, I believe the 3 things was your bridge, your bird dog, and the hip flexor stretch, right?
Yeah, the 3-way hip flexor stretch.
Okay. Can you, maybe go over that. Can you go over the hip flexor stretch one more time? Just, you're freezing it for me. You just froze again. So, there you go. So you're freezing every once in a while there. So the hip flexor stretch, you have 3 different ways of doing that. Oh, she said 3 things to feel. She said something about feeling. You were talking about feeling the exercises.
Yeah, it's probably related to the glute bridge. So what I want you to feel is make sure that if you're squeezing your butt, that you should be able to squeeze one at a time, the other at a time, and then together. And so when you do a bridge, you're going to drive through your heels. You're going to use those butt muscles to drive yourself up. What I don't want you to feel is using your low back. So if you're just really kind of arching your lower back every time, that's where I want you to not feel pain there. I want you to feel, actually, my glutes, I just practiced squeezing a bunch, is the ones that should be activating on the way up. And so I'm pretty sure, I don't know if that was 3 things, but hopefully that addressed the main cues I had for that exercise, because I didn't have as many cues for the other 2.
Yeah, I've been, it's funny teaching online exercise now. I'm even more aware because I'm watching myself in the video, and I'm watching other people in the videos too. And it's just interesting. I find sometimes myself, I sometimes, watching other people, whether we do a squat or a lunge, we don't get that full extension at the top. With the squat, for example, people come in, they come about 3/4, but they don't get that butt squeeze, right? So, Brian just mentioned the bridge and getting that squeeze there. But think about that on all the movements, whether it's the hinge, that good morning deadlift, whatever, the squat. Just always remember, guys, get that full range of motion. Don't cheat. And, sometimes people go too heavy, right? And they just don't finish the exercise.
Right.
We're missing the most important part sometimes.
What I'll add to that, even though we're talking about back pain, but one for knee pain, because knees are bothersome. And people say, man, stairs kill me with my knees. When people don't have good quad activation, they're really not gripping the ground and pushing through the floor. Your body's going to result to just using joints. It's going to load the joint over and over again because that's the path of least resistance. It's a lot harder to use all those muscles to activate your quads when you go up through and the glutes to get that step up. So we just kind of take the easy way out. We load our joints, and that's the compression happens. So even though you look like you're doing the exercise the right way, what I've noticed when people learn the best with these exercises is, what am I supposed to feel? It might look the same, but am I internally feeling what the goal of this exercise is supposed to feel? And that can kind of change up a huge dynamic of everything building blocks after that. There's a question from Sean. So if it really hurts, pulls, stretches, it's okay to back off a bit, but keep trying often and it will get better. This is where it's tough when I don't have someone in front of me because everybody's different. So I'm going to try my best to speak in kind of general terms. When we're doing the right kind of exercises for our backs, our back is hurting, we want to be able to not increasingly ramp up pain, right? If I'm in acute back pain, when I hurt my back months ago, I mean, doing pelvic tilts, like, that didn't feel good, but I know I needed to do it. I wasn't making things worse. I wasn't constantly ramping up that, like, okay, it was a 2 out of 10 and I keep doing it. Now it's an 8 out of 10. When I give exercises, I kind of give a range of like, hey, if it's a 2 or 3 out of 10 and it kind of stays there, we're doing pretty good. And if we do a program and then 24 hours we're back to our baseline of like, hey, you know, it's a little achy that night, the next day we're back to good, then I also know we didn't overdo it. We were just getting some movement, some blood flow, and we weren't actually over killing ourselves in that exercise. If you did it, like, man, that knocked me out for 3 days, it was way worse, then we know that's really not the exercise for you, or it was too much. So it is always tough without someone in front of me, but I want to say that hurt doesn't always equal harm, but we should be controlled with some of that discomfort if it is the right exercise for you. I hope that can kind of help a little bit. No, it's a very vague way of answering it. They always say in school, it depends, and it kind of does. Yeah, I think that was the only question there. And still open for questions for another 5-10 minutes if anybody's got anything too. And you know, if people really like this kind of thing, and Brian and I can talk about it later, I'm always happy to come on and talk about other parts of the body. If we want to have like an open forum where I can help you both, or everyone that's on this presentation, if I can come as a consultant somewhere to help you all out with any way I can. I can always build something with Brian we could talk about after this if there's ways I could just still help you all even when you're distant and remote. Hey, Joni, it's nice to see you again. Thanks for showing up here. Any ideas for neck exercises? Maybe that's the next presentation, neck pain. Again, it's tough for doing individual cases because I think I mentioned the idea about back pain, right? So there's stenosis, there's low back strains, there's disc bulges, all these other terms we've heard. Typically, some injuries are more prone to be worse with extension-based exercise, and some are going to feel better with extension. Some back pain might feel worse with flexion, and some might feel better with flexion. So until I can see the whole picture, it's hard for me to say, here's just a neck exercise, go for it. I will say this though. I would say predominantly, I see a lot of people have weak, deep neck flexors because we live in a society where we're hunched over on a computer in front of a, driving. So these actually get kind of shut off. Your deep neck flexors are kind of like the core of the neck. So I know it's a kind of a boring one, but literally just practicing your chin tucks on the ground and making sure that you're working these muscles, they can get pretty tiring. You can lay on the back, tuck your chin, lift up about an inch off the ground, come back down. And if you really start strengthening these muscles, it'll actually help your head in a better position. Because I see typically we don't really have tight necks, we really have weak necks. We're carrying around this huge head all day long. And so people are like, oh, I got to stretch it, I got to get a massage, I'm so stressed out, I'm so tight. Really, it's just that we're not built for the endurance to handle our head all day. We're in these positions all day. And so when I strengthen the neck, it's actually does a lot of good. So deep neck flexor strengthening exercise is one of my go-tos first when people, I'll assess it to see if they really have a strengthening deficit, but typically they do. It always depends. Hopefully that helps. I'm sorry if that wasn't specific, but it's hard without having a person in front of me. Thanks for the question though. Hope that helped. Any more questions? If not, you can always reach out to me, reach out to Brian. We can talk about things later on and do this again sometime and all that. So I think we might leave it there with that, Brian, so everyone can enjoy their evenings. If you want to have any closing remarks, we can go from there.
Thanks, Brian and Brian. You'll be hearing from me. I definitely have some issues that I would like you to look at.
Sure. Great to have you. Love to meet you in person, and hope we can help you for sure. Thank you.
You can. Thank you.
Oh, my pleasure. Brian, you got any closing remarks?
All right, sorry about that. Yeah, so thank you, buddy. Appreciate it. And yeah, let's do it again. And I know we have one more question here from Hiba.
Okay.
I got dogs barking in the background.
So, do I do chiropractic? No, so chiropractic's another healthcare profession. They got their doctorate degree. PTs get their doctorates too. I support both fields. We have different methodologies, a little bit of treatment. Some of our manual therapies are similar, some of them are different. Really, you put a good one in the room, good chiropractor, good PT, they're both going to get you better. So I endorse everybody. We just have a little bit different philosophies on treatment approach, but again, I see good results from both when you have a good one in the same room. Are injections bad? Then the pain is risky, right? You know, there is a time and place for injections. I've seen some pretty chronic backs that they've tried conservative approaches, they've done the imaging, and something is impressing on their back that's not getting better. There is a time and place for everything. Again, nothing's an absolutes. I just, I gave some of those statistics. There is just a big drop off when physical therapy can help, but there are times when patients of mine go get a steroid injection, or they do have surgery. Sometimes it is necessary, but sometimes we're seeing surgeons become more conservative, and physical therapy seems to be a better approach, at least initially. And then we readjust to that if down the road things are not getting better. Okay, thanks. All right, well, that's awesome. Keep in touch with me if you ever have questions. Hopefully, Brian and I will do this again sometime. If you all like it, I could talk about anything. I'd be more than happy to help you all out. So you got my email, contact information, and we'll be in touch. Thanks a lot for spending your evening with me. It was a pleasure to see some of your faces on the screen, and appreciate it, and have a good evening, everybody.
Thank you all for showing up. Thank you, Dr. Brian, and I will get this video on YouTube, and we'll share it. And feel free to share, guys. Please share it. It's good for everybody. It's just great information, less back pain, better health. Thank you, guys.
All right, thanks, everybody.
Thank you.
Drink some water. Every time you drink alcohol, have a glass of water.
All right, Brian, I'm signing off. We'll chat soon, all right?
Take care.
Thanks again
Bye,
for the
everybody.
opportunity.
Yeah.
Appreciate it.
Bye.